Hi, I'm Ashley, self-proclaimed resources nerd and staff member at Futures Northwest. Today's guest is the wonderful Dr. Colleen Coyne from North Shore Veterinary Hospital to talk about her career as a vet and animal acupuncturist. Welcome, Dr. Coyne. Thank you so much for joining me today.
Thanks for having me.
Yay! Okay, so first off, can you tell us a little bit about yourself, your journey into veterinary medicine, and did you also always know that you wanted to be a vet?
As far as I can remember back, I always wanted to be a vet. Yes. I grew up in Bothell, Washington, and I think my first memory of knowing I wanted to be a vet was probably when I was about 4 years old.
Wow, that's amazing. And how did you pursue that pathway?
You know, I think the main thing was just visualization. That's what I visualized. And I knew I had to kind of drive hard in school to get there. I'd heard that. I think it was challenging for me to visualize it just because back when I was a kid and we would take our pets to the vet, it was always a man. There's always a male veterinarian. I never met a woman veterinarian, so I didn't know how I was going to do that. But I managed it, and nowadays there's mostly women veterinarians. So knew I had to push on in school and make sure I got into college, and then it was 4 years in undergrad and then 4 years of vet school.
Wow. And then what is the most rewarding part of your job or the favorite part of what you do?
Gosh, the most rewarding part of my job is just being able to heal something, and relieve their pain if they're hurting, and also to keep them healthy, to prevent disease is wonderful. And so, just being around animals all day long is really special,
Yeah.
It was a dream. I do enjoy doing emergency medicine and critical care mostly. And so that's kind of what I do at North Shore now, is urgent care vet medicine. So that's my favorite. And I do a little bit of natural, like a holistic care as well. I do some acupuncture and herbal medicine on the side of working at North Shore Veterinary Hospital. So,
that's wonderful. I think I remember you telling me that like cows really enjoy acupuncture.
Oh, yeah. Cows and sheep. I think one of the first patients I had for my acupuncture, which I just, it was like 2013 when I went to that program, and it was about a 1.5 year long program to get certified in acupuncture and to veterinary acupuncture, that is. I don't do acupuncture on humans. One of my first patients was an old geriatric sheep named Bob, and Bob, and he belonged to this woman named Bobby. So anyways, this sheep was 14 years old, and he reportedly wasn't eating and wasn't getting up, and hadn't for about a week, and that's usually not good and usually doesn't bode well. And she was considering euthanasia for him because he was suffering. And I heard about him through a friend of mine, and I said, well, for what it's worth, let me try acupuncture on him if she would like. And she was super eager to do that. And so I came out with my stuff, and I put some needles in this guy, and half an hour later, and he seemed to be enjoying it, and he relaxed and felt good. And later on that day, he got up for the first time, and he ate that day. And then I treated him, I think, a couple times a week for several weeks, and then monthly thereafter. And this guy lived quite a bit longer. He made it through this. I think he made it through the summer, and I think it was later in the fall. So I think he was around for another 8 months or so. And this person was so happy, and he was very comfortable during that time.
Oh, That's beautiful. Thank you for sharing that.
Yeah, it was very rewarding, and it really encouraged me to do more of it. And I've seen it be extremely helpful for so many cases and so many patients.
Yeah. Oh,
Yeah.
so sweet. What does a typical day look like, if there is such a thing?
Yeah, there really isn't such a thing, because it's every day is different, and every day has surprises, especially in urgent care. But even if I wasn't doing urgent care, it's different every day. And but a typical day, I get up and get to work at 8 o'clock, and I review what's coming in on the schedule. And we just kind of do a schedule, not because we can actually see those patients within that time slot, but because it just makes it a little easier for everybody. So they kind of show up at different times. But we obviously see the most urgent things first. And so if, somebody, pet comes in with a laceration, and then another one pulls in a few minutes later that's having respiratory problems, I'm gonna bring them both in, but we're gonna see the respiratory patient first. We might give somebody who has a laceration pain medication if they need it. But
Right.
And so I see patients just all day long. We try to get a break at lunch, but oftentimes we don't. So it's one of those kinds of careers that you just got to have some snacks around. And it's every once in a while I do surgery. I love surgery, actually. So I might need to remove a spleen from an animal that has a mass on the spleen that's bleeding, and I want to get that organ out of there so they stop bleeding. So that might be something I do within a day. Or, sometimes a cat might have an obstructed urinary tract. That's something that happens with male cats, not uncommonly. So I might have to, sedate them and unblock them, and, get them going again and feeling better. So yeah, it's usually like that. And then I've got to do a lot of record keeping. And that's probably the part of my job that I find the most challenging. I don't really like to sit still very much. And so that's, I have to sit down and type, and some people dictate in that, for their records. And then I've got a lot of callbacks I have to do too, a lot of communication with people where I, look at lab work that I've done earlier in the day or the day before, and review that with them and make a plan for future care. It's great. It's literally always exciting. And it can be hard, we have to make decisions sometimes with people that are, for the well-being of the patient. If they, aren't doing well, and there is nothing that we can do for them anymore, sometimes we have to relieve them of their suffering, and with euthanasia, and that's a tough moment, but it happens, and it's part of my job. And that's probably the thing that keeps some people from ever wanting to do that. However, it is something that was tough in the beginning and is still tough, but it's necessary. And I feel that it's part of relieving suffering for those individuals that need to have that. Yeah. So, but really, I mean, we laugh most of the time at work. We're laughing, we're having, we're sharing our struggles or stories, the good stories, whatever, our successes. And we work together a lot and collaborate. I've been practicing with a few of the same people for the last 21 years, and it's pretty neat. We're family, and we really are comfortable working together. So. And most of the time it really is every day. Yeah, most of the time I leave and I feel fulfilled with my career, and just I wouldn't have it any other way. It is wonderful.
Thank you.
Yeah.
One thing I'm wondering is, what advice would you give students or adults who might be interested in working in veterinary medicine?
Uh, I would say get some experience. See if you can get into a vet clinic working as a kennel assistant or even a receptionist, or see if you can just observe, job shadow somebody. Because sometimes it doesn't, sometimes it doesn't take very long to figure out if you want to do that or not. I mean, I've seen people who walk in and they're like, yeah, I'm sold, I'm in. And then other people who stay for about a half an hour and they're like, yep, I'm good. I think I'll just pet people's animals or have my own and enjoy, pets that way. You have to really enjoy working with people too. And I'm a little bit of an introvert, but I do enjoy people. And so you have to know that you're comfortable with that, that you like to relate to people, that you somewhat understand, how to go about that. And if not, just push yourself until you are. There's other avenues in vet medicine too. You don't have to be a clinical practitioner like me. You can choose to work in research. You can work for a pharmaceutical company. You can become a zoo vet. That's harder to do, but you can do that. You can be a wildlife vet. Those jobs are a little harder to get a hold of, and they sometimes, like wildlife veterinarians, they're not going to earn what a clinical practitioner is going to earn. So, but there's other ways you can go about it. You can work in public health, even, like, helping with control zoonotic diseases, which are the things that people can get from animals, or, the other way around. But so like rabies and, toxoplasmosis and there's a bunch of them, Campylobacter, Cryptosporidium, go on and on. It's actually an interest of mine a little bit, but I chose to go this route. So, but yeah, there's tons of different things you can do. And nowadays, especially since the pandemic, you can actually consult with people online. There's some legality, liability issues that have to be looked at, but you can be a consultant. There's even companies that have hired vets to do that. So somebody might talk to you online about something, then you would maybe tell them that's something you're going to need to actually take the pet in to see the veterinarian for.
Like, and that's hotline kind of.
Yeah. So that's happening. And it used to be just a big no. We're not doing that.
Yeah.
But since the pandemic, some of it's become necessary, and we've done it a little bit through our clinic, where somebody might send a picture of an incision and say, this thing looks a little red, what do you think? And we'll look at that and say, yeah, it looks a little red, let's see that. Let's check that out. So why don't you come in? So that's kind of neat. It's kind of helped a lot to limit people's need to visit the clinic during the pandemic, when we didn't want to crowd. And it's, the pandemic's made it interesting for sure. It's the population of pets has exploded during the pandemic. People were at home and they thought, what do I do with this time? I better have something fun to do. And I'm, we're whatever, uncomfortable with the situation. So let's get cheered up and let's go out and get a puppy and a few kittens and, chickens or whatever. And it's been a little bit challenging for the workforce, the veterinary workforce. We did not
you didn't see that coming?
Get to take a breath. What's that?
You didn't see that?
We didn't multiply, we didn't, our population did not quadruple, but the pet population did. So
oh my gosh,
it's been pretty unbearable. And there's been some very long waits in the emergency clinics. Sometimes some of these emergency clinics all the way up and down, all the way across the country. And I think actually throughout the world, in urban areas especially, this was a situation that happened. And so 6 to 8 hour waits at the emergency clinics, not unheard of at all. And some clinics even say that they're at capacity, which is unheard of, you know, where you call and they're like, can't take any more. So you got to call the next emergency clinic and the next one. So yeah. Anyways,
Well, yeah,
we're kind of hopefully coming to the end of that and things might go back to normal, but there are a lot of new pets out there now.
yes, there are. So we need more.
We need more vets.
Yes. So
Yeah, I'm excited about, you know, mentoring people that want to do it. And I think all veterinarians should be excited about that right now. And I think many of them are. So we
yeah,
need to expand the workforce for sure.
absolutely. And is there anything else that we didn't touch on in our earlier conversation that you'd like to share with us today?
Let's see. I think one of the things that overwhelms people about the profession is just the schooling. And they think, you know, I'm not that great at math, or I'm, you know, whatever. I think that's a big thing that stops people. Well, there is some math you have to get through, no question about it. They want you to go all the way through calculus, and you've got to do some statistics, and so, but do you have to be awesome at it? No, I think you have to study really hard and get through it. And then, you know, when you are actually a vet, the math is not super complicated. You know, it's a challenge, you know, and sometimes, you know, you're having to figure out how much of what volume of this concentration of drug do I need to add to this, you know, liter of fluids to get a concentration of this.
Yep.
And what rate do I run it for getting this much into this animal, not exceed this, you know, level. So, you know, there's some math, and it is, you know, I consider it somewhat fun, but I'm a little bit geeky too. So that's okay though. Geeks are good, right? So yeah, but it's not impossible. And I think that it's important not to let that be a deterrent. I think, you know, get a tutor if that's a problem, you know, and there were certainly things that I had challenges in school with, and, you know, inorganic chemistry was, yeah.
I hear that's brutal across the board. Yeah.
It was, you know, and then there was physics and genetics, and I love genetics, but so I didn't love it all. And, but we got through it, and you just need to take each day at a time and know that there's always help if you need it. And then one day you look up and you're a vet, and
wow,
or you're doing it, you know? So I think it's, you know, don't get intimidated by the schooling. The expenses is one thing, and, you know, there are scholarships available and student loans. I took student loans out, and it took a few years, probably about 8 years to pay those off. And then, you know, things got better. But there's lots of jobs out there in the vet profession. Technicians, you can be a veterinary technician, which is, they have a lot of responsibility as well. You can be a veterinary assistant. And so that's kind of assisting both the technicians and the vets. And you can be, you know, somebody who's in the hospital, just making things flow, manage a business, whatever. There's all kinds of ways to be in the profession and not necessarily be a vet.
Yeah.
But yeah, I mean, it obviously, and the responsibility is huge. I mean, you know, a lot of people I work with that are techs they know that they would have never wanted to be a vet. And the reason being that ultimately the responsibility lies on us, you know, as far as making decisions, helping make decisions with the people that are bringing their pets to you. And, you know, having to go through the hard stuff too with them, but that doesn't mean that the technicians don't feel that stuff as well. It's just that we've got to, you know, be the ones that present that to the people bringing the pets in. And studying cases, and, you know, and some people just don't want to do that. They're not into that. They might be interested in it, but they don't want to be the ones to make the final decisions about that.
Right.
Yeah.
it sounds like there's a place for just about any level of engagement, you know,
Yeah.
from kennel, what did you say, kennel boarding, or what was the first?
So a kennel assistant would be
Yeah.
somebody who would be making sure that the kennels are clean and comfortable, and maybe restocking the hospital, making sure that there's always, you know, the syringes and the needles and the gauze or whatever in the right place, making sure that it's a sanitary environment for that kind of work. And so you can do that, or, you know, we have a woman at North Shore who's a business manager who was a former technician. She was a technician for years. Now she's skilled in managing a vet practice, which is, we have about 40 something employees. So she's got quite a job, and does a fantastic job. Yeah, so there's all kinds of ways to go about it. Reception, a lot of people like doing reception work. They like being the ones who triage, you know, and say, yes, that needs to come in, and we're going to move you up to this position because that's really painful or that's life-threatening. And
Right.
so so those folks are making decisions and communicating with the people, and they have you know, they have to be very tender and know how to communicate with distressed people, and
Right.
distressed people can be challenging to work with.
Yeah.
They're anxious, and you've got to kind of quell that anxiety for them, let them know that, you know, we're gonna help you, and you know, come on in and we'll get to work on this, you know. And so there's all kinds of ways to go about that. And other people can work with animals that don't want to do vet medicine. They can, you know, go into training, obedience stuff. You know, there's all kinds of other stuff like agility, nose work, you know, different things, fun things that people like to do with their dogs to give them a better quality of life, and, you know, use their dog smarts. And
Totally.
so there's a lot out there, and we're lucky to live in a world that we can, you know, where we have that kind of privilege to be able to do those things with animals. And yeah, so we do. I mean, in Bellingham is a huge dog place, you know, just, yeah, it's pretty cool. Oh, you can work in the Humane Society. That's the other thing. You can work with getting animals placed in homes, and taking care of that population.
Dr. Coyne, thank you so much for sharing your story with us today. For more details on the information we discussed, check out North Shore Veterinary Hospital. And remember to subscribe and like this channel for more resources and information to take your next step in life with confidence. If you want even more great resources, you can check out our website at futuresnorthwest.org. Thanks for watching. Bye.
Bye. Thank you so much.